Hi, my name's Baz and I'm a pharmacist. So I thought I'd just quickly talk about sort of career progression in the medical field. So I've been quite lucky to have experienced a lot of different rotations in my place of work because I'm a rotational pharmacist. So I've been through oncology, I've been through critical care, I'm now doing pediatrics. And something that I've learned in my time of doing loads of different things is that you're never really taking a step back, even if you don't necessarily progress. So in the NHS we have like pay bands and things like that, but it's not always about, working up to a more senior role, for example, or, trying to be a manager or trying to, get more money. Sometimes it's about taking a sidestep and trying different things out just to see what works best for you, what you're interested in, and it makes you a more well-rounded person. I feel like a lot of skills that I've learned over the years has been because I've sort of been dropped in the deep end in lots of different clinical areas, and I've been able to transfer those skills across. So never think that you need to kind of focus on one specialty straight away and think that you need to focus on that and try and work your way up through that. Think about trying different things. So for example, now I'm going to try out mental health, and I've never done mental health before, and I'm excited about it, and I might not like it, and that's completely fine, and then I can go and find something else. I think often we think that we need to be progressing really quickly, trying to get to the top straight away, and I think the benefits of being in the medical field is that there's just so much to learn all the time, and I think sometimes you could be selling yourself short if you focus too quickly and trying to work your way up too quickly. So I've always had an interest in mental health. I think it's really interesting. It's quite niche, very specialist, but I think what I find most interesting about mental health is the actual pharmacology of how the drugs work, and the fact that it's still very new. There's still a lot of things that we're learning about mental health and we'll continue to learn, and I like being in areas where we don't know everything completely, because it means there's room to explore, there's room to think about things. For example, like with cardiology, you kind of have your set medications and set treatment plans for certain conditions, but with mental health you kind of have to play around. It's very individualized, like to the patient. So I think that is what I'm looking forward to the most. And also, a lot of people think it can be quite sad, and it can be, but these are the most vulnerable people of our population. So I'm quite excited to get a chance to work with them and help them. So I've done, like I said, I did oncology and aseptics, now doing pediatrics. I've done elderly care, I've done admissions. What else have I done? I've done critical care, I've done home care, which is like high cost drugs. I've done respiratory, so I've done a lot of things. And as much as I've enjoyed all of them, because I'm just someone who likes to learn new things anyway, none of them really took to me in a way that I was like, okay, I could probably spend a lot of time doing this particular specialty. So that kind of led me to, and I've never done mental health like fully. So we sometimes get patients with mental health issues, but it's not something that we deal with fully. So now I have a chance to really learn about that side of medicine. My final advice would be try whatever you can. Whatever opportunity is thrown at you, just give it a go, because I didn't even think that I'd like pediatrics. I was adamant that I wouldn't, and I tried to get out of doing the rotation. But as soon as I started it, I loved it straight away. So, don't sort of sell yourself short of opportunities. Try everything out. You never know what you will learn, what opportunities will be available to you if you completely shut something down. And we're in a profession where there's literally so much to learn, like the world is your oyster kind of thing. So just go for it.